Guys, look at this question. Recently, I put this in the story, and surprisingly, many of you are wrong. How can we forget ABC, that is airway, breathing, and circulation, in any diseases? Now, in this case, we have 35-year-old male came to us with shock and breathlessness. His ECG is showing sinus tachycardia, S1Q3D3 pattern is there, that is suggesting pulmonary embolism. And now it is confirmed with CT pulmonary angiography, which is showing this type of clot in the pulmonary artery. So the diagnosis is clear that this is pulmonary embolism. So how should we approach this case? So first is ABC. A is airway. Look at the airway of the patient. Now there is no history significant suggesting that airway is affected. So we move on to the breathing. If breathing is abnormal, yes, he is having breathlessness. But if they have given that there is a significant hypoxia, then we might need to sedate and intubate this patient and put him on the ventilator. But that is not the case. Now coming to C. C is for circulation. Now they have already told that this patient is the shock. What should we give? We have two options. First is fluids and second is vasopressors. But in case of pulmonary embolism, we should never give plenty of fluids as it is given in the option, because plenty of fluids can increase RV overload and can worsen the patient's condition. So what we give is the vasopressor. We can give norepinephrine that will improve the symptoms, and sometimes inotropics like dobutamine can also be given in this patient. Now in treatment of pulmonary embolism, if patient is stable, then we can give heparin, which is the option C. But in this case, patient is in shock, and that's why definitive treatment will be thrombolysis. So as I have asked for the next best step, it would be vasopressors and not plenty of fluids and not thrombolysis. And that's where reading theory and applying practical concepts is completely two different aspects. And that's why to solve this problem, I am coming with emergency medicine masterclass, in which we will discuss real life case based scenarios and how to approach these cases step by step in workbook based model. It is going to start on 22nd of January. If you're interested, just comment ED, and yes, don't forget to share this video with a friend and follow me for more such content.